Hi, I'm Neil Kelleher. In this video I'm going to talk about side bending the spine. And a side bend for the spine is simply bending to one side or the other, but I'm going to show it in a number of different poses, but also how to actively side bend your spine. So a couple of things you could focus on when side bending. You can focus on either the open side, making the open side feel open. You can also focus on the short side, making the short side feel active. And just as a point, you might ask, why bother working with side bends? One reason is it's a basic action of the spine. You can probably get quite, I would suggest it's a basic action for the spine, something that we don't tend to do a lot of, and I myself have been skipping it out more recently. Before, maybe up to a year ago, I used to include some sort of side bend in all of my classes. I haven't been working on it lately and so I've just started bringing it back. But in general, it can be a good way, along with twisting the spine, which is something that I have been doing, can be a good way to keep the spine mobile. It's a good way to connect to your abdominals and your intercostal muscles. And actually doing weighted squats, side bend with bar on my back and bending one way and the other, that's one of the ways I've been generally warming up. And one way you could consider side bends is if you work on, particularly if you work on the contracting aspect of the side bend, it can be helpful for your lower back. It could be a way to work towards balancing the sides of the low back, working on quadratus lumborum. Could think of it as a way to stretch the thoracolumbar fascia, also a way to learn to activate the serratus posterior inferior muscle, which are the muscles which angle from the ribs to the bottom of the thoracic spine, top of the lumbar spine. As for the thoracolumbar fascia, that's the fascia in this area of the body, in the lumbar spine area, that covers the sacrum, extends to the sacrotuberous ligaments, also includes the muscle I just mentioned, the serratus posterior inferior, also made up of layers of the latissimus dorsi, attaches to the glute, is the massive connective tissue that covers the back of the sacrum and the SI joints. So it's quite an important structure, and side bending may be one way of accessing the thoracolumbar fascia. And not that you can stretch it that much, but it could be a way of working on it to a certain extent. So as mentioned, with side bending, a simple thing that you can focus on when doing side bending, so you can actually recognize when your spine is being side bent, is to bend to the side and focus on contracting the side you are bending towards. Now, one difficulty, particularly while upright, is it can be easy to do a relaxed side bend. So just bend to the side and you get no sensation, or you get some sensation, but unless you're tuned into your body, it's harder to feel. So one thing that you can focus on doing when side bending is actively contracting the shortened side. So if you wanted to include your hips doing a standing side bend, you could push your hips to one side and then from there contract the opposite side of the waist and the rib cage. And I'll show you from the back. So hips to one side, bend to the other, actively contract the waist and the intercostal spaces. So you can try doing that, maybe make your neck long, or if you wanted to, you could actively bend your neck to the side as well. Then come up, push your hips to the other side, contract the waist, contract the side of the rib cage, neck long, or side bend the back of the neck as well. Now, a couple of poses that I like to, just for fun, so a couple of ways that you can integrate side bends into standing poses. So for example, in triangle pose, if you bend to one side in this pose, again, you could, depending on the flexibility, you could side bend upwards. What may happen is you end up more upright. What I like to do in standing side bend is to bend the spine downwards. And here again, the idea, rather than relaxing, try to actively contract the bottom side of your spine. What you may find then is that your rib cage comes closer to the leg. So a simple way to do it, contract the shortened side, and then relax if you like. Place your hand on your leg, lift, contract the short side, relax, lift, contract the short side, and then relax, come up. You can do the other side. Now, if I'm focusing on side bending, I'll ignore the legs, but something else you could do is do something to activate the legs, so make your legs strong and then contract the side of the spine. But for this instruction, I'll just keep it simple. So here again, contract the short side of the body, slowly and smoothly. Relax, contract, short side of the body, relax, contract, and then relax and then come up. And something you could do while contracting, you could pull your belly in first, so you're using the transverse abdominis, and then from there contract. And if you activate the transverse abdominis attached to the thoracolumbar fascia, and when it passes, so the transverse abdominis, the connective tissue at the end of the transverse abdominis, it actually connects to the sides of the lumbar spine, but there's a portion that passes in front of the spinal erectors, and then there's a portion that passes behind the spinal erectors, and that's the tube is actually called the paraspinalis retinacular sheath, something like that. God, that's a mouthful. But basically, if you want to affect the thoracolumbar fascia, one way of doing that is by pulling in, by using the transverse abdominis. And so one way to use side bending to more deeply affect the thoracolumbar fascia, pull the belly in first, and then actively side bend. That's something you can play around with anyway. So another pose that you can do side bending in is side angle pose. So if you, with the legs apart, slightly wider than triangle, bend, actually what I'd suggest, drop the hip first and then bend the knee. You can start with your hand on your leg or your elbow on your leg. From here, lift the arm. So belly in, contract the bottom side, and then come up, relax. And what you could do, first thing you could do, lift the arm. So transverse abdominis engage, contract the short side, touch the hand to the floor, and then come up, relax. If you wanted to, you could try touching the elbow to the floor. So belly in, lift the hand, try to reach the elbow to the floor. Keep the belly engaged, contract the short side of the body, and then come up. Belly in, contract the short side, come up, belly in, contract the short side, and come up. So this option might be handy if you want to work towards binding in side angle pose. Hopefully I called it side angle pose. And again, if you can't touch your elbow to the floor, don't worry about it. It's simply something to work at to get you deeper. If you can only touch the hand to the floor, that's fine. The more important point actually is using the side bend of the spine to try and get the elbow closer to the floor. But it can be kind of fun as well to try and touch the elbow to the floor anyway. But drop the hip, bend the knee, forearm on the leg. So from here, so you can change the sequencing if you like. You can pull the belly in first, then lift the arm, pull the belly in, contract this side, and come up. Belly in, lift, contract. Come up, belly in, lift, contract, and then come up. So coming up, ideally you can do it with a little bit of style. So that's another way that you can work on side bending. And just to show you from the back, so this is the side. So again, belly in. What you're trying to do, contract this side of the waist so the lumbar spine gets bent. Contract this side of the rib cage so the thoracic spine has a bend. And then you can work on increasing that bend to touch either the hand or the elbow to the floor. Now another variation is in this pose to do a similar thing to what we did in side angle pose. And in this pose, something that you can do before doing the side bend, and this is something I like to do in my classes just for fun, is to, without moving the body, so without going like this, simply lifting the hand. And a quick note, so if you can't lift the hand without losing balance, what do you do? So you may find your leg tends to lift. So if that's the case, what do? You shift your body. And which way do you shift your body? You shift your body away from the hand. So here, so find a position where you can lift your hand with impunity. And that can be the exercise, if you like. You might find it helpful to push the knee down first, and then from there lift the hand down, relax. Press the knee down, lift the hand down, relax. So again, it's not doing this, it's doing this. Press the knee down, lift the hand, and then if you like, come up and do the other side. So again, so if you can do this easily, something you could try doing is seeing how far towards the hand you can shift while still being able to lift the hand with impunity. So press the knee down, lift, relax. So I can feel this hip locking up a little bit. Anyway, press the knee down, lift, relax. Press the knee down, lift, and then when you're ready, come up. So I'm going to take a quick break there to sort out my hip. But next we'll go on to side bending in that position. So it's not always obvious, but if something hurts or something is uncomfortable, stop doing it. Or take a break if possible and explore the way that you do that action to see if you can figure out if there's a way to do that action without causing pain or discomfort. If it's cramping or something like that, even with muscle cramping, often if it's not dietary or some other reason beyond your control, may simply be activating muscles in different ways to prevent the cramping. But going back to this position, what you can then do, lift the hand. So here again, the idea can be to contract the short side of the body. And here what you can aim for is touching the elbow to the floor. Then come up. And if you can't touch the floor, just go down as far as comfortable with control. Then come back up, pause, and then come back up. And this can be the resting position. Lift the hand, contract the short side. Whoops. And come up. Lift the hand, contract the short side. Come up. Lift the hand, contract the short side, and come up. So obviously the top side, or maybe not obviously, but the top side is going to be working as well, particularly if you go down slowly and smoothly. Something else you could also try, touching your shoulder or even your ear to the floor. So this is something you can do for fun. So contract the short side. See if you can touch your shoulder to the floor or even your ear, and then come back up. And one of the things you will find is this can be a lot of work on your hips. So this can be a way to stretch the hip while at the same time making the hip active or strong. And what I'd suggest is that would be one proviso. If you're very flexible, if you're one of these people who can drop into the splits, leave this exercise out unless you can activate your hip while doing this exercise, unless you can actually feel your hip being active while doing this exercise. If you're just doing it, flopping down, coming back up with little or no control, you may be putting a lot of stress on your hip joint. So how do you avoid that? Make the hip joint strong or active. So for example, what you can do, as we did with the hand lift, make the hip active, press the knee down, then from there, bend this side of the waist down, and come up, press the knee down, make the hip strong, touch the elbow to the floor, and come up, press the knee down, hip strong if you like. Try reaching the shoulder, and then come up. So this side for me, that's actually quite hard. But anyway, so there's a few side bends you can do. One other one you could do is half moon pose. And what you could do is, with the foot turned out, in this position, what you could actually do is bend the spine side upwards. So shorten this side, relax, bend the spine upwards, relax, bend upwards, relax. Falling with style. On the other side, so same thing, or trying to. And this assumes you have enough balance. So one thing you can do to do this pose easier, shift your weight towards your forefoot. So use your forefoot. So keep your weight on your forefoot. All right, so from there, bend upwards, relax, whoops. Use a wall if you need to. Bend upwards, relax, bend upwards, relax. And that's actually one of the reasons why I almost forgot about this pose. When I was teaching these side bends recently, I didn't bother teaching this pose because the students I was working with, their balance isn't that good, and that could be my fault as a teacher for not working on it a bit more. But if I did want to include this pose, what I'd do is I'd do a lot of weight shifting first, feeling weight on forefeet, heels. Also shin rotation, using shin rotation, pressing down inside and outside of the forefoot. So practicing balance first, and this leg tends to be my bad one. I have to work a lot on this one. So if the focus is on side bending, it's easier to do the other poses that we've done. But if your balance is relatively good, then this is something you can include. But if you wanted to work on your balance first, something that you could do, focus on forefoot, focus on controlling the rotation of your shin, maybe work at making this hip active, and then from there, whoops, so even there, so bend the spine up, relax, bend the spine up, relax, bend the spine up, relax. So that can be, if your balance is good, if you need to work on your balance, practice the balance aspect first, controlling your shin rotation, foot control, and then from there work on the bending upwards. But another option, if you're flexible enough, is to do half moon with the hand on the floor. And then from there, what you can do is focus on the bottom side, keeping your hand on the floor if you like. Contract this side of the waist, relax, contract this side of the waist, the bottom side, relax, contract the bottom side if you like, lift the hand, and then come up. So contract the bottom side, relax, contract the bottom side, whoops, relax, contract the bottom side, and then come up. So even there, balance is still relatively critical, but as well as contracting the side of the waist, do focus first on controlling your foot and the shin, and then from there maintain awareness of that, then contract the side of the body downwards. But anyway, there's some side bends you can do. Most of them, the critical point in those was learning to feel the side of the waist, trying to actively contract. It's something else I forgot to do in the half moon that might have made it easier. So just trying the bending upwards on the bad side. So control So one of the things I'm working on doing, pressing through the outside edge of the foot, making the calf and the ankle feel strong. And to keep that, I have to go very slowly and smoothly into the pose. It's something you could do, whoops, pull the belly in first, and then contract. So let me, because obviously I'm not going to be able to do that right now, or waste a lot of video time, but something else you could do, contract the belly in, then contract the short side. Relax. Contract the belly in, short side, relax. Contract the belly in, and short side, and then relax. And this could have been something I should have tried doing in this position as well. This hip was locking up, something you could play with because the transverse abdominis affects the SI joint. And that in turn can have an effect on the hip. So something else you could do in this position, pull the belly in first. And then from there, whoops, elbow, even the shoulder. And that actually feels quite a lot more comfortable on my hip. So something you could be aware of, so something you can get from this when doing side bends or when working on your hips or when combining the both, when combining the two using your hips and side bending, might be helpful for you to pull your lower belly in first and then do the side bend. And as a reminder, when you pull your lower belly in, particularly when you pull past the border of your rib cage and your pelvis, and this isn't doing something like this where you're sucking your belly in but actively pulling it in using the transverse abdominis. The transverse abdominis affects the thoracolumbar fascia. It also affects via the thoracolumbar fascia, or directly it affects the SI joint, can affect the hip bones. And one way you could think of it is by making the SI joints stable, you're actually stabilizing the pelvis or stabilizing the hip bones. What that means is that any muscles that attach from the hip bones to your femur or from the hip bones to your lower legs, they have a stable foundation from which to work. So what that means is that you can use your hip bones a bit more, you can use your hip joints or your hip muscles a bit more effectively to stabilize the hip joint. And so if you have, so one way to positively affect your hip joints, pull the lower belly in. Anyway, that's what started off with a talk on side bending, but ended up being about the transverse abdominis, the thoracolumbar fascia, the hip joints, the SI joints. What started out with a simple side bend ended up being a bit about that, but hopefully that was helpful. Thanks for watching. Namaste. Let me just try that one more time. So I'm going to pull my lower belly in first. Then I'm going to adjust my foot. And then I'm going to slowly tip to the side. And this might be simply a case of being warmed up sufficiently. From there, bending upwards. So a bit wobbly. Relax. Bending upwards. Relax. Bending upwards. Maybe even lifting this leg and then coming up. So see, I can do it. So I've already said goodbye, but so another thing you can do when working with problems is sometimes, so for example, that was a problem with the hip. Sometimes it's not necessarily the joint in question that's a problem, it's something further upstream or downstream. And the basic idea that I work with is creating stability. So if you have muscles that are giving you problems in some way, shape or form, then the simple idea is to try and create stability somewhere in your body. And it's not just a question of, stabilize the core. That's too basic. It's more, although it did work in this case, but basically the better you understand your body, the better you can create stability wherever you want to. So it could just as easily be stabilize the knee, make the knee stable, or stabilize the hip joint, make the hip stable. In this case, it was actually also stabilizing the SI joint. So, but basically, when dealing with problems, look at creating stability in different places, or make sure you've created stability in different places so you have better control over your joints. But anyway, that is now goodbye. Thank you again for watching. Namaste.